please. The honourable for Calgary Elbow.
Thank you, Mr. Speaker. Last week, the Auditor General released a groundbreaking report on Alberta's healthcare system, including a recommendation that funding should be linked to outcomes. He argues for the use of market mechanisms within a public healthcare system, and I couldn't agree more, Mr. Speaker. Let me be very clear. I believe passionately in public health care, and this report says nothing about privatization. But we know we need to set aspirational goals to deliver better care to more people for the same amount of money. To the Minister of Health, do you accept this recommendation? If so, when are you going to link funding to outcomes?
Thank you, honourable member. The Minister of Health.
Thank you very much, Mr. Speaker. I want to thank the Auditor General for his report. His ideas support our push to make life better for Albertans by improving access to team-based care, integrated care in their communities. And that's why we're better integrating doctors and support better care for patients through our new AMA agreement, Mr. Speaker. This work is well underway. I'm very proud of it. Instead of pushing for rash ideological cuts, as both Conservative parties, 3 Conservative parties, 1 Conservative party want to push on the other side, we're making life better and working with frontline workers to do that, Mr. Speaker. I'm so proud of our progress.
Honourable member, first supplemental.
Mr. Speaker, I'm over here and I'm not part of any of those parties, and I never will be, so I'd appreciate an answer to my question. The Auditor General called for bold action, taking a quantum leap rather than incremental changes, but I've seen no evidence that this government is up to the task. Albertans pay more for health care here than anywhere else in Canada, and we need leadership to ensure that we get what we pay for. Again, to the Minister of Health, your changes to date are just nibbling around the edges. Will you commit to making the fundamental, transformational changes that the Auditor General called for?
The Honourable Minister.
If the member opposite wants to pretend he's not united with the other folks, maybe he should look at his own voting record, Mr. Speaker. So I have to say we deserve better integration, and we're proud to move forward on that, Mr. Speaker. That's why we're investing $400 million to better integrate and share information across the healthcare system, improving access to accountability within primary care networks. We have been working and making very significant progress in partnership. We're working with health professionals, not doing things to them, and I'm so proud of the paramedics who are in our audience who are doing work to make sure under the Health Professions Act they're expanding their scope of practice as well, Mr. Speaker, making healthcare better for every Albertan.
Second supplement.
I'll put my voting record up against theirs and yours because Albertans know there's a middle way and a better way, Mr. Speaker. The Auditor General also found significant overlap between Alberta Health and AHS. This is something we've known for a long time, and it's certainly a legacy of the previous government, but they're not in charge anymore, Mr. Speaker. This government is. So it's time to stop making excuses. Again, to the Minister of Health, what specifically are you doing to eliminate duplication between Alberta Health and AHS, and what metrics are you using to track your progress?
The Honourable Minister of Health.
Thank you so much, Mr. Speaker. I'm so proud of the work we're making and the fact that we are working together as many different parts to make healthcare better instead of having infighting between 2 different organizations, Mr. Speaker. We've been very effective in moving things forward. There isn't a parallel management function between the 2 organizations, but rather a close working relationship that determines how policies will be reflected in the services delivered for Albertans. Alberta Health sets the policies. AHS carries them out on the front lines through frontline healthcare providers, including the paramedics who are here today. For example, AHS sets continuing care standards, AH sets them, AHS implements them, Mr. Speaker. That's the right division of power.
Thank you, Honourable Minister.